Welcome to Rev Up Your Business with Hilda Gann, the podcast for people-centric leaders, business owners, and HR professionals who know that people are at the heart of business success. Join me and industry experts as we explore the key aspects of building a thriving company, sharing cutting-edge strategies, impactful insights, and the latest trends to help you ignite your business growth. It's time to rev up your leadership, rev up your success. Let's get started. Welcome to another episode of Rev Up Your Business. Today we're going to be talking with Sharon Lee about leading with purpose, building teams, trust, and a culture of giving. Sharon Lee is a nonprofit executive with over 20 years of experience leading people-centered organizations and creating lasting community impact. She is the executive director of the Canadian Pulmonary Fibrosis Foundation, where she has spearheaded transformational growth through collaboration, equity, and innovation. Sharon was the first woman and person of Chinese descent to serve as the president of the Rotary Club of Etobicoke, and now serves as the president-elect for the Toronto Rotary Club for Toronto West. She has found the How to Fascinate insight to help her in leadership roles. She's what we call the maverick leader, and in fascination terms, she speaks the languages of innovation and power. We'll get into that more shortly, but Sharon leads with creativity, bold ideas, and a drive to challenge the status quo. So join us as Sharon and I talk about creating people-centered nonprofit workplaces where trust, collaboration, and purpose drive both donor engagement and organizational success. Welcome, Sharon. I'm so glad that you're here with us today.
Thank you for inviting me, Hilda.
It's so good to have you. And I love how you talk about purpose-driven workplaces. And I want you to maybe share how you actually empower yourself to work with your board and your team.
I'm a believer that when you have two people in any given room, there's always going to be dynamics that don't fit. Sometimes the dynamics do, sometimes they don't. And I've often wondered, like, how do we communicate better? I've done exercises where you have your back to somebody and someone's giving you instruction about how to put something together. But somehow you get most of it correct, except for a few things here and there. And then you realize that everybody communicates and listens in a different way. And so one of the reasons why I was searching for a tool that could help myself, my team, and my board to better communicate, because if we are better at understanding where each of us are coming from and that we are striving for these particular strategic plans or goals, then we could be paddling the same direction instead of working against each other, right? And then at the end of the day, the goal is to empower our community for them to know that we hear them, we see them, and we support them. And that's one of the reasons why I wanted to do the fascination tool.
I know that when we first talked about it, and I gave you the tool itself, you became known as the Maverick Leader. And for those that have been following some of my podcasts where we do talk about fascination, Sharon's first primary language is innovation. She has that ability to think out of the box, create these ideas like, where did that come from? And then she has power as her second language, so the ability to take her knowledge that she has and make decisions and move forward with that. Do you want to talk about that revelation of you and fascination?
Yeah, so in my lifetime, I've taken many sort of self-development from Myers-Briggs to Your Colors, and each of them were very difficult to understand. But with this fascination tool, like, it instantly clicked, and I thought, I've always known that my personality is like, I can go around it, over it, under it, just, doesn't matter. If there's a barrier, I'll figure a way around it. And people always are surprised by how I get around things because I just think, well, if this is the way I want to go, how do I get there? What's standing in my way? Who can I bring along to help me? And so the fascination tool really helped me. And I've never thought of myself as a maverick leader. I'm always quiet, I'm polite and everything. But I realize, yeah, I do, because I try to be more collaborative. And then sometimes I go, okay, I'm done. And that's where my power comes out. This is the way it's got to get done. And I just drag everybody going. And I realize that because of that, I have to pull myself back and bring everyone with me so that I don't have to end up using my power. But I do know that for the people who, if there are 10 different ways of doing something, they have to explore each of them. I will say, right, we're going to pick two. I'll let you pick the two. We'll explore it. And if it works, that's it. We're not going to look at the other eight.
That's the decisive person in you. And using the fascination language, the people who sometimes need 10 is the mystiques. The mystiques is the language of listening and gathering information. And sometimes they need a lot. And if power is one of their lower languages, they may have that indecisiveness because they need more and more and more data and they can't quite decide. So this is
Yeah.
interesting. And I find that, you and I talk quite a bit about CPFF, that you really are, you're probably one of the people that really embrace fascination and understand and want to know each one of the team members, that you have, as well as all the board members. You want to know what they are like as individuals so that you can work collaboratively with them.
Yeah, it's all about respecting that individual. I want to know what is it that I need to do to help me, right? And then by them helping me means that we can do more for our community that we're serving. And so if it means that we have to explore a couple more options, then I will do so because I understand that as an innovator, as a patch and power person, I can bring that to a hold and moving it forward. And so I'm not bothered with that. It's only when I don't understand where they're coming from and I've gone around, I've done everything, I go, well, okay, I've done this, and it doesn't work. I don't understand what's wrong. Is it me? Is it them? Is it the wrong project for them? Do I have the wrong people around the table to support them? I'm just trying to ask all the questions because one of the things I firmly believe in is like never assume, always ask. I always will ask someone, so why do you believe in that? And why do you believe we should go that way? And I want to listen because maybe they can change my thought and thinking, go, oh, I haven't thought of it that way. Yeah, maybe that is a better way of going. Because I'm not bothered. It doesn't have to go one particular way, right? When I say to somebody, I would like to come here, what do you think? And if you said, you know what, Sharon, the best way to go down that path and get there is to go this way. That's what I would do because I respect that that's your expertise, your experience, and you're helping me and guiding me to get the best results by going the shortest path, right?
Let's get back to that. Like you're talking about, being flexible here, but you also talked earlier about values-driven collaboration. So when you have your staff, obviously that would be an important factor when you're hiring people, right?
Mhm.
That you want the values of the organization to align with the values of the people that you hire. How do you make sure that is aligned?
Well, what I try to do is beforehand, we get them to do several tests just to see where they are. Because I've learned in my 20 plus years career is that one thing you cannot change in someone is their personality. You can give them the tools, you can teach them new skills and everything, but their personality you'll never change. Personality is always the same. So if someone says, "Oh, I can't do that," no matter what you do, you can't change their mind, right? So then you have to figure out what can I get that person to do that still would be very fruitful for the organization, self-satisfying for themselves, and still be able to collaborate and work with them. So that's the thing that I do, and also too for them to understand where I'm coming from, because as a maverick leader, I get it. Sometimes I overwhelm people. It's like, oh my God, all these ideas, I can't keep up. How does she do it all? Like, oh my gosh, I don't understand because I didn't understand what their personality was. and if I explained it to them already. In my brain, in my world, I've already gone from A to Z. I've already seen it. I've already done it. I figured it out and I'm ready to go. But somebody's still at B and they still quite can't figure out how to C come next, right? And so this is where I need to use my skill set and the tool acknowledgement from Fascination is to help them to get where I am.
Yeah. And by you keep saying, get where I am, I want to share that my understanding is that where you are is for the good of the organization, for the good of CPFF.
Yes. Because everything I do for any organization I've ever managed, I always think, what is the best way, the most efficient way to get there? I've already looked at the stats, I've already calculated the odds of success, failure, and everything. It's just that quite often I've forgotten to share that information. It's already done in my head. And, as one of my coaches said to me, John said, Sharon, he goes, I can see you've already figured it out in your head, but I'm telling you as your coach, you got to bring all those other people with you. And so I said, okay. So now I understand. I worked it out in my head. I engineer it backwards and I would say, what does a mystique person needs to hear from this plan? What does a passion person need to hear from this? What does a prestige person needs to hear, and so on and so forth, so that I put that out there and then I could just rejig it and then get everybody to be on the same page so that by the end of my presentation, they're all where I am and they all agree with me that this is the best course of action to supporting our community, right?
I love how you do that because a lot of people who take fascination really understand it for themselves, and they also understand that, okay, if I'm a prestige, which I am, that means I'm believing continuous improvement. I'm always improving things. But sometimes you may have difficulty reaching other people because you think that what's in your brain is in everybody's brain. And I'm currently working with a group of people who are really trying to transform their leadership. And a lot of them are innovators like you. And when we had the Q&A portion of our session at the end, some of them says, okay, so I'm an innovator. I have these amazing ideas that I would love to help my clients with. But oftentimes my clients are the language of trust. They want stability. They want predictability. They don't want earth-shattering changes necessarily. So they were saying, well, so how do we communicate with the trust? And some people think that they have to become a trust type person. But I
Yeah.
say no. As Sally Hogshead says, different is better than better. Embrace your uniqueness.
I never try to surround me with the same people because then we never have any different ideas. So for my team at the Canadian Pulmonary Fibrosis Foundation, I have one person who is the trust. They build things. They like systems. And another person can bring and gather people together. And another person can go out and get the resources. And so, as one person said to me, Sharon, if somebody gave you a blank piece of paper, within 5 minutes, you can come up with a concept, draw it out, create it, and everything. I look at a blank piece of paper and all I see is blank. I don't know. But if you gave me something, I can say, oh, well, you could be a little more efficient here or a little more efficient there or a little less of this. And so what I do with my team, and I call them the dream team, is that I come every quarter with my thoughts. Here's where we are. Here's what I see that we need to change. Because although we said we're going to do this, I'm saying that we can't always go in this straight line. Sometimes we zigzag a little bit. Sometimes we go around a curve. And what my team staff people will say to me, they appreciate the fact that I will say, this is where we want to go. Okay, Hilda, how would you do that? giving your expertise. Okay, you, how would you do that? So everybody comes and brings their expertise, and then I put it together, and then we have the best strategy plan. People who are in social media marketing as well, if you're really going to target those people, it should be done in this way. Somebody else says, oh, well, if we're going to write a newsletter, it has to express it this way, and so on and so forth. So at the end of the day, I've gotten everybody to come along with my ideas, but they are the ones who are helping me to build the layers, right?
Mm-hmm.
Because although I've come to realize I could do all those things, they're not my forte. They're not the things that I enjoy. They're the things that they enjoy. So why not allow them to enjoy doing that? And at the end of the day, we create it. So I think of myself as if we were on a boat. I'm the scope that goes out, scout the area, scan the area, take in the information, calibrate. We got to go to the left, we got to go to the right because there's an iceberg or whatever. And the people working alongside with me are the people who are going to say, okay, we can blast that iceberg out, or oh, we can just go this way, take less time. They're the ones that help me to do that. And because they enjoy it, right?
Yeah.
And so this is how we get to where we're going to go. And that's why a lot of people who look at my organization think that we must be a huge organization, but we're not. For the first 5 years, it was just me. And then I added an additional person, then I added another person. And so if you look at it, we have a fulsome library of great information. And we are raising a lot of awareness, right, out there, telling people how do you recognize the signs that you might have this rare disease? How do you go and have a conversation with your family physician to say, can we just verify that this is not the rare disease that I have? And be polite because we're not medical people. We're just saying here are the four signs, common signs, and all your doctor has to do is listen to the crackling sound, if there is any, in your lungs. If there is, they just have to make a referral to see a specialist like the respirologist. If there isn't, then they can explore other options. But we're just saying be proactive.
Yes. Yeah. Yes. And it is a very rare disease, and the charity that you have is really about helping people raise awareness of this disease and then support it. One of the things that I know is challenging for any charitable organization is really getting the dollars that are so finite in terms of people's giving, and decide that I'm going to give it to this organization or I'm going to give it to this organization. How do you build that donor trust so they'll say, yes, CPFF is something I believe in and I want to support, and here's my money, Sharon.
Yeah, so my philosophy has always been all never assume, always ask. So when somebody comes and says, I'm thinking about making a donation, I never assume that it's for us. They might just be asking for some advice. And so I often will say, okay, well, what are you envisioning? What do you think you would like to do? And they tell me. And so I recognize that there are 88,000 wonderful charities across Canada, and we're one of them. And I'm here to make sure that the donor is going to receive something that they're looking for. And sometimes when the donor describes to me what they're looking for, I said, at my organization, we're not capable of doing that. But I do know of a couple of other charities that might be able to do that with you. So, if you want to work with them, I can certainly make the referral. And people are always taken aback. And I said, well, I'm here for you. I'm here to listen to what you are looking for, what your desires are, and how can we fulfill it. And so because of that, people feel really comfortable and trust. It's like, I'm not saying, give me all your money because you said you wanted to donate. I'm saying, I'm really listening to you, Hilda. I'm hearing what you're saying. And I'm just telling you that this is not possible to do with us. But if you still want to do something with us, here are some other options that you might wish to consider because we can do that with you. And I think because I do that and I get my staff to do it, I think people just go, wow, these people are really here for me. It's not about, oh, getting me to write the check or making that donation. It's really hearing me, seeing me, and helping me to fulfill something that I've been wanting to do, in support of my loved one because they have this disease. And it's like when I did the CBC radio shows, I used the tool that I learned through fascination, how to read each and every one of those hosts that were interviewing me. And I try to think about the community that we were in and try to think to myself, if I lived in that community, what would I need to hear as a nugget to say, wow, that was worth listening to. And I only had a very short time. And so, for the Ottawa segment, I said, you know what, in Ottawa, you're very fortunate that you have the healthcare resources you have, but unfortunately, you don't have a large ILD center that could help you if you had this disease. And I said, and so that's why you need to know about these four symptoms that might be an indicator that you have this disease, not necessarily, but might, and a simple tool that for your doctor just to hear your lungs to see if they hear any crackling sounds. And so after that, a day later, this woman called me up and she said, I heard you on my way to work. And I thought, I wish I knew and my husband knew about this because for 3 years, we were trying to get him diagnosed. And I said to him when I came home, I heard this lady speak. I think you need to go see the doctor and ask him to listen to your lungs. And so they did. And she said, because of that, they go, oh, I think you have this disease. And she said, for 3 years, we went out, but you just told us four simple things to do. Talk to your family doctor. And now we're on this journey to getting help, right? And another person called and said that they didn't know that her husband had this disease. They struggled with it until they found out, but it was too late. And then he died. And she said to me, I wish we had known and that, you had the opportunity to tell us. But anyway, so she said, I just want to say that I support what you're doing. And so she wrote us a check. And again, it's all about understanding your community, understanding your patients that you're trying to serve, understanding the family and their struggles, right?
Yeah.
Because everybody's struggling. Everybody's trying to figure out how do we resolve this disease. There is no cure at the moment. There's only hope that by, getting early diagnosis, going on therapies, that it can extend your condition for as long as possible before you have to consider maybe getting a double lung transplant, right? Down that road.
Yes, thank you for sharing some of the ways you help people, because CPFF isn't just about getting money to support. They're actually reaching out to the community and involved with doctors and getting scholarships so doctors will specialize in this disease. And I remember I was asked to facilitate at your board's retreat earlier this year, and you and I thought, the board needs to take this fascination assessment as well to help them be more effective, because we're going into a retreat for several days. And I said, allow me to help you understand who you are and then collectively work as a team. And at first, some people thought, well, 20 minutes should do it. And I said, no, this isn't an icebreaker. This is learning how to understand who you are in your most powerful, natural, instinctive self, as well as learning now how each one of you interact with each other as a team. And to my surprise and delight, the team analysis showed that the primary language of the team, the board, is trust, which you expect because a lot of people join, they have a fiduciary duty, so they have to be, they have to make sure that the stability is there, the predictability, and the lower risk that trust people tend to have. But their secondary language was innovation. And possibly it was that number was because 4 of the new board members actually had innovation as a primary secondary language. And I remember saying to the board at the time, this is powerful. You have the trust and you exude that trust, which you expect from a board, but you have this innovation, which is out of the box thinking. And in today's society where there is limited dollars, those organizations that come up with great ideas, that come up with ideas to connect, to make wanting to give more desirable for a particular organization, that innovation piece is great to have, right?
Well, I also did it because I wanted my board to understand who I was as well, because
Mm-hmm.
I could see that I frustrated some of them, right? Because they'd go, wow, how does this woman go here, go there, go everywhere, do this? And but she brings all this money in and everything else. Like, I don't understand. And I just thought, okay, this is an opportunity for them to understand where I'm coming from, how I work it, and that we are actually are all on the same page, except that each of us has a different way of expressing ourselves or hearing the same thing. Five people in the room can hear five different things, even though it was said the same way. So
Mm-hmm.
it was a really great way for us to learn more about each other and build that trust within each other.
Yes, yeah. I found it very invaluable from what I saw, and I presume you felt the same way.
Like you said, at first they said, oh, I don't know, it was only a 20-minute breaker. And my board chair said, okay, I'm gonna humor you to do it. And I said, well, you don't have to humor us to do it. I'm just telling you it will be a very good and useful tool. And at the end, even our hardest critic had said, I really learned about my fellow colleagues and about you, Sharon. And I feel much more comfortable, right?
Yeah,
Rather than thinking, well, where's this woman coming from? How does she just shoot from the hip and always know? Because I recognize that at times my board, um, they sort of were annoyed that I always seemed to know the right thing to do. And what I realized was that I wasn't telling them that I actually had taken all this information, absorbed it, calculated it, and came up with this strategic plan, right? And so this is some of the things that I've learned that was valuable. And so now, because I understand where this person's coming from, I think to myself, how can I give them something to do so they come to the same conclusion, right?
yeah,
I could have done it, but why? Let them do it and let them present it, let them say it, and then it's done. Nobody will ever question it again.
yeah, yeah. We've talked about philanthropy, and that's what you do. I want to end our conversation by talking about philanthropy in company culture and how organizations who do that can be seen as a place that I want to work to. So it is somewhat of a retention strategy, but I want to hear your take on philanthropy into companies' work cultures.
Well, for the nonprofit charitable organizations, oftentimes, when I volunteer on their boards and everything, um, they just said, I don't understand why we're not moving forward. I said, because you're just busy collecting the money. You're not understanding what these donors are asking you to do. So if somebody says, I'm going to give you $2 million to do this project, that's great. But is it going to impact in your community? Is it part of your strategic plan? If it isn't, I would have said, thank you very much, but that's not where we're going. So
Mhm.
that's the number one thing with nonprofit charitable organizations, that they always just take the money, do the project, but does it really build upon what they're trying to do to serve the community that they're looking to serve?
Yeah, yeah,
And then for corporations, I understand they do it as a social responsibility, but not a lot of them really mean it. And so what I do is I go in and I listen to what they're trying to do. And I said, wow, I said, I love your strategic plan. And I said, I can already see here, 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 and there is where I can fit and help you to achieve your goal. And so I'll just use pharma, for example. Pharma has drugs that could help our community. And so they all says, oh, we have a good drug. And I said, well, that's great. but has it gone through the FDA? Has it gone through Health Canada? Has it gone through all the process and the reviews? And if they say yes, that's great. I look at the results, and then I ask my community, is this something that you would want to access, given the side effects, given this, given that, give them all the facts. And if it is, I tell the pharmas, I said, then you need me to submit a submission to the Canadian Drug Agency to say, here's why you need to approve this so it gets to be accepted in Canada. So people with healthcare plans can get access to it, and they can pay for it because they want it, right? And then after that, I said, then I will be working with every single province on their formulary to say, how can we get this drug onto their formulary so that it is reimbursed for those people who don't have a healthcare coverage or who simply cannot afford the drug, right? Because we want to be equitable for everyone.
Yep.
And so I do that, and I make this rationale about how it's good for their business to support us to do all those actions, and then they see the ways of doing it, right? And I said, sometimes I said, you have to show people that you're doing something that you have no expectations of anything out of it because it doesn't benefit you in the long run. That is true philanthropy, right?
Yeah, yeah. Well, I know when we had our company, my husband and I, iTrans, we got to a point where we were 25, and there's a sense of caring and giving that my husband and I have. And I said, we're 25 people now. We're at a point where we can start to participate in the United Way, because growing up, I had good memories of United Way funding in fundraising in high school. And I love the one-stop shopping concept. It has so many different agencies that it supports. So I thought that's what we wanted to do. And at 25, people could volunteer to donate, but nobody needs to know whether they did or they didn't. And so to me, that 25 was a magic number where you could hide behind, if I can't afford it or I don't want to give, I don't have to. And the other thing we did was we created a campaign, because they have this campaign where the first week they ask for the donations, and the second week they have basically community fundraising, team building events. And we did it to the point where people looked forward to it every year. And I was surprised at the amount of giving that some of them, who to me had limited dollars to donate to donations, and we as a company did a matching. So to us, yes, it was our social corporate responsibility, but we made it as a team building effort and a sense of goodwill. And we did other things too. We promoted volunteerism. People would get an extra day off if they could show that they did 75 hours worth of community involvement. It could be the PTA, it could be coaching your children's thing, or belonging to a board or whatever. But that was our gifting to our people, because it's important. And I think a lot of people will join a company where they feel there is corporate social responsibility there.
Yeah.
What's next for you or CPFF, Sharon? Tell us a little bit more before we say goodbye.
Well, the next thing that we're trying to do is we're trying to have equitable access to oxygen across the country, because it really does matter where you live. Every province have different rules of how you qualify, what you can receive, and if they will reimburse the cost of oxygen. And oftentimes I have people say, gosh, I need 10 tanks of oxygen, but I can only afford 5. So I ration it, very carefully. And I thought, well, what kind of life is that? They can't go out, they can't do anything. They're just at home because they can't afford the extra tanks that they're going to be leaving outside the home. Because most home oxygen, it's not a problem. You have the machine there, and they'll give it to you, no problem. But it's when you're traveling, when you're trying to be mobile, right? So we're trying to do that. And the most exciting thing is that there's some drug development that they've just finished their 3rd phase clinical trial. And so we're hoping that it goes through all the FDA, Health Canada, various, audits and reviews, because we at the Canadian Pulmonary Fibrosis Foundation, we would like to see a world free of pulmonary fibrosis. right? We would like to see everyone to be able to be cured from this disease or slow the progression that you can live with it all your life, right? Like they can do with HIV these days. So this is where we're going for the next little bit. And we're keeping our fingers crossed and hoping that one of those drugs that's at the very end of this clinical trial, that'll make it through. Because for every 1,000 clinical trials out there, less than 0.01 of them ever make it through, right? So it's it's just exciting time, and I'm hoping that that will come to fruition soon.
Okay. Well, we've been talking about philanthropy. If people want to donate, I don't usually do this, but if people want to donate, how could they get a hold of the donation people or you?
Yes, you can always email us at info@cpff.ca. That's info at cpff.ca, or go to our website, and our donate button's on the right corner on the top. So I want to thank you if you consider doing that, because we are small but mighty, and we're here to help everyone that has this disease. And I wanted to say that one of the reasons I wanted to do this is just to tell other people the best thing you could do is invest in yourself, in your board, and your team by doing this fascination tool, because it really, really works. And I just want to say that, Hilda, you're one of the few people that I work with doing all the various things I've done, like Myers-Briggs and everything, that makes it very easy and very understandable, and make it reflective on yourself, that you can think, oh, I can see that now, right? And I think that by using this tool and helping my organization and my team, we actually are able to help our community, because I always say, when we lead with purpose and put people at the heart of everything we do, we don't just build better organizations, but we build a better world, because we understand each other. We know how to communicate. We know how to collaborate. And that's the way it should be, right? And I try very, very hard to bring that edict to fruition with everybody that I come in contact. And if you wanted to, reach out to me, you can too. I'm on LinkedIn, and if you email at info@cpf.ca, you can reach me there as well.
And for those who are listening, it's Sharon Lee, and the Lee is spelled Lee, because it could be spelled many ways. Sharon, thank you for coming on today. You are a very passionate person, and you really do make a difference at CPFF with your innovative, creative ways of leading, your decisiveness to lead. And those are really helping to make this small but mighty organization, who is working with rare diseases, your ability to advocate for patients and their families, to provide research, to support doctors to go into this specialty so that they can continue to help more people, and to work with pharmas to find those drug cures and make them connect with the people who need that. You are an amazing individual. I've enjoyed hearing your thoughts on leading with purpose and building trusting teams and culture of giving, and the fascination tool, and how it really has made a difference in the way you lead and you connect with others. Thank you very much.
Thank you very much, Hilda. It was a pleasure.
And to those of you who are listening or viewing, thank you for joining us today. My first nonprofit conversation. So, of course, I had to offer a donation to those who are interested and wanted to donate to this very, very good cause, CPFF. Thanks again for listening. Give it a thumbs up. And if you haven't subscribed already, do so. Thank you for tuning in to Rev Up Your Business with Hilda Gann. Be sure to like, comment, and subscribe to our podcast on YouTube and Spotify to stay up to date with all of our latest episodes. For more HR tips, strategies, and to learn how you can create a people-centric workplace, visit our website at peoplebrightconsulting.com.